Bovine early pregnancy test cards usually have a high accuracy of over 95%. The accuracy of these cards is mainly affected by the following factors: brand and quality. Accuracy of bovine pregnancy test cards may vary between brands and models. Timing of the test. The timing of the test is critical to accuracy. It is generally recommended that the test be done around 28 days after the cow has been pregnant, as this is when the levels of pregnancy-related hormones have risen to a level that can be detected with a high degree of accuracy. Physiological status of the cow. The physiological status of the cow may affect the accuracy of the test card. For example, the presence of luteal insufficiency or other physiologic problems may affect the accuracy of the results. Environmental conditions. Environmental conditions during the test, such as temperature and humidity, may also affect the accuracy of the results. Procedure. Proper procedure is also important to ensure accuracy. The instructions should be followed to avoid mistakes. Overall, the bovine early pregnancy test card is a convenient and quick tool that usually has a high degree of accuracy. However, to ensure the accuracy of the results, it is best to use the results of the test card as an initial guide when making important decisions, and to perform further confirmation or testing when possible.